For my first treatment, Dr. Prefontaine explained what was going to happen during Lipodissolve and talked to me about my expectations. I had always struggled to keep my midsection area slim and toned, especially after having 3 kids. I was excited that there was a treatment that could actually do something about it. He explained that a lot of women carry weight around their midsection and that this treatment actually dissolves fat cells, getting rid of them permanently. He had me roll my shirt up and roll down the top of my pants. He evaluated my problem areas, which for me is my abdomen and flanks, and he tailored my treatments to the parts of my shape that I most wanted to change. Then Dr. Prefontaine asked me to lie down on the table so that he could map out the treatment area using a white eyeliner pencil. He drew a grid on my skin that helped him to know where he would need to place each injection. This gave him a guideline so that he did not inject the same area twice. I was nervous about the injections, but he explained that most people tolerated them well, and he was right. During this part of the process, he talked to me about what the injections would feel like, how he determines the treatment area, and what I should expect as far as results. After Dr. Prefontaine and his assistant finished mapping out the area to be treated, they began the injections. I was really scared about this part because I hate getting shots, but this felt nothing like a shot. The needle was so tiny it hardly felt like anything. Dr. Prefontaine made sure I was comfortable and gently held sections of my skin one area at a time and injected them with the small needle. I was so pleasantly surprised about how easy it was and how comfortable I felt during the injections. All during the treatment, I talked to the assistant and Dr. Prefontaine and felt fine. Only a few areas were sensitive to the treatment. Other than that, I hardly felt the needle. During the end of my treatment, I started to feel a little stinging sensation and my skin looked red, but Dr. Prefontaine explained that it was normal and it would go away on its own. After he finished the injections, he explained that I will be tender around my abdomen for a little while and that I should avoid long baths, strenuous activities, and alcohol for a few days. He said that I may have some bruising or swelling and that they would give me some topical ointment that can help me heal more quickly. I was tender for the next week or so, and I did take it easy for the first few days. But after 3 weeks, I could already tell that it was working. I could see a real change in my shape. After treatment, Dr. Prefontaine's assistant applied some ice to my abdomen and then applied some of the arnica ointment that you take home with you. Then she massaged the area with a handheld massager. She told me to apply the ointment 3 times a day and massage the area to reduce swelling. I also needed to wear a supportive undergarment for the next few days, which really helped me feel more comfortable.
Indigo MedSpa, beauty and wellness, guided by science.